On December 26, 2008, 19 nursing students from the University of Vermont traveled to the continent of Asia to participate in an international service learning course in Bangladesh. Our objective of the trip was to focus on issues that impacted the health of the Bangladeshi people, while also learning about the role of a nurse in a global community and public health setting. We began the course in the capital city of Dhaka, where we met students and professors of the independent university, Bangladesh, for the first time. We spent the first 4 days adjusting to our new surroundings by touring the city and spending time at the university. Bangladesh is a Muslim country, and we learned it was respectful to dress modestly and to wear the traditional attire. Although Western dress is becoming increasingly popular in the cities for women, we decided as a group to wear the popular shalwar kameez. After riding in a rickshaw, shopping at one of many markets, and tasting the local cuisine, our group, along with 7 members from IUB, departed Dhaka for Prashika. We learned the non-governmental organization of Prashika was located in the rural village of Maniganj. Along with governmental organizations and international agencies, NGOs have provided various villages in Bangladesh with developmental services that have had positive impacts on everyday lives. By providing jobs, refining farming methods, improving sanitation, and growing food, individuals are able to provide for their family while also affording basic health care. Through NGOs, various aid groups are able to implement and test a range of models of development on site. As students, we were hoping to learn from the previous models and examine their impacts on the villagers' overall health. Upon our arrival at Prashika, we divided into 5 groups and developed a focus on which to base our research. The topics were poverty, gender health, social cultural norms, social supportive services, and environment. Each group gathered data from a minimum of 20 families in the Maniganj village area. Through the assistance of our IUB interpreters, since our group knew little to no Bengali, all 5 groups were able to generate questions and interview families pertaining to each particular community health issue. During our time in the villages, each group acquired health histories and completed blood pressures, heights, and weights. As a member of the environmental group, I quickly discovered the significance flooding has had on the land and its people. Flooding in Bangladesh is a serious public health issue, responsible for many deaths and the spread of communicable diseases, which affects millions of people there. During the annual rainy season, lasting from June to October, many homes and fields are damaged in the low-lying area of the country. The damages cause great economic loss and endless human suffering, which continues without adequate relief. For Bangladeshis, annual flooding is a fact of life, and ongoing climate changes are likely to worsen the situation. The research my group gathered in Bangladesh stressed the need for further steps to be taken to minimize the widespread devastating effects of flood disasters, particularly increasing preventative measures and furthering relief, especially on the healthcare front. During our 3-week time period in the country, we traveled to hospitals, health clinics, shadowed community health workers, while continually addressing Bangladesh health issues. We developed a greater understanding of the role of a public health nurse while noting areas that needed improvement along the way. In combination with classroom learning and fieldwork, we were able to examine historical, environmental, social, and political forces that impacted the health of the population in Bangladesh.